And the public health risk for the bird flu is very low, but researchers are keeping a close eye on how it spreads. As Ted Linder reports, there's concern that we could see a strain that's transmissible through person-to-person contact.
Researchers are looking into how the latest virus of avian-influenza, or bird flu, is making its way to other species.
The fact that this particular virus is doing that and it's continually going from wild birds into mammalian host is why it's of particular concern.
Dr. Jacqueline Knowlting, an assistant professor in animal health and biosecurity at The Ohio State University, says dairy cattle are currently causing the most concern.
The way that we raise cows is just different than maybe some other animal species that are really well prepared to deal with an infectious disease like this.
The Centers for Disease Control and Prevention reports bird flu has affected more than 800 herds of dairy cattle as of December 13th. But researchers say consumers shouldn't worry about the milk they drink.
As long as it is pasteurized. Pasteurization completely inactivates the virus.
The CDC says the virus can still be transmitted to humans, especially for those with exposure to sick animals.
If you are just a person that is not going to farms, not working on a farm, not ever going to the woods, you probably have a very, very low risk of ever seeing this virus.
Meanwhile, the CDC says 60 human cases have been confirmed in the U.S. this year, but 2 of the cases were not linked to any sick animals, raising questions over the virus being spread between humans.
There's always potential for influenza A viruses to spread between animal species, between humans. Right now, it looks like the likelihood or the risk of that is pretty low.
Knowlting says anyone who contracts bird flu should treat it like a seasonal flu with antiviral medication. Ted Linder, Fox News.